You know, working from home with laptops isn't always the most ergonomical setup, and it could have some of you with wrist and arm pains. Dr. Maggie Wilson is a hand surgeon at Walker Baptist. She joins us now to kind of talk to us whether or not you're dealing with pain, inflammation, arthritis, or is it carpal tunnel. How you doing, Doc?
Hi, great. Thank you. How are you?
I'm doing good. So tell us, what is carpal tunnel?
Well, carpal tunnel syndrome really happens when some compression of a nerve in the wrist called the median nerve gets too much pressure on it, and so it gets compressed in the area.
Yeah. What are some signs or symptoms that people might be getting if they have carpal tunnel syndrome? It's easier to say than it is.
The most common things that people complain about, especially early on, is either pain or some numbness and tingling, or both. And those are usually the earliest findings that people have in the hand and the wrist.
How is it diagnosed?
Most often doctors can diagnose it just based on the patient's complaints and some physical exam findings in clinic, whether that's some numbness or weakness in the hand. If there's any concern, we can get something called a nerve study, but most often it can be diagnosed just based on complaints and physical exam.
Okay. How is it treated?
There's a couple things that we can do. For mild carpal tunnel, where it's just a little bit of pain or some numbness and tingling, we can try non-operative management, which would be things like a brace. We can even do some steroid injections into the area. If that doesn't work, or if the symptoms are more severe, there are a couple of surgeries that we could offer the patient to just relieve the pressure on the nerve.
Yeah, what are those surgeries like, or what is that surgery like?
Yeah, well, the goal of the surgery is just to relieve that pressure, like I was saying. And so there's two ways to do it, and most surgeons do both ways, and they can tailor it depending on the patient. But there's an open way where there's just a small incision in the palm, which just releases the nerve's pressure. Or there's an endoscopic way where you can use a camera inside the wrist to look and release the pressure on the nerve also, and both work equally well.
I would think, though, that recovery time might be a little different for either one.
Recovery time is very similar for both. Usually patients only need to take a couple of days off of work for this surgery. Usually the pain is resolved within a week, once stitches come out and the incision can heal. It does take a while for the numbness to go away, but from the carpal tunnel itself, but pain.
Okay. Dr. Maggie Wilson with Walker Baptist, thanks for joining us today. We appreciate you, okay? All right, good deal. Thanks for